Hello students, and welcome to your pathology class. Yes, you get me again. I have 3 courses with you for this semester, which is really exciting. I'm so happy that I haven't left you guys yet. So want to give you an overview of your pathology class. So if we go to your syllabus and your schedule, you will see that they are both loaded. Your syllabus is basically the same as the other syllabus that we have for your 210 course. So my email, best way to get a hold of me is email. Also, those of you that know me and are able to text me, that's great. We are going to be using the comprehensive radiographic pathology book that you should have received in your bundle. So we'll be doing that along with the workbook, and you're going to be bringing the workbook to Jeremy in your 230 class, which is your physics class, and he's going to go ahead and sign you off. Basically, the way that that's going to work is it's if you do all of it, then you get 100%. If you do most of it, you get half off. So make sure you do every page and that it's completely filled out. So here are the dates that you'll need to know, the course description, and we'll be covering the whole body on different pathological conditions, and we'll be looking at X-ray, CT, MRI, and ultrasound with those pathologies. Your learning objectives and your outcomes, which I told you to pay attention to. We have your weekly assignments, and I'm going to go over what those weekly assignments are. We're going to talk about what AMP Mini is and how to do an AMP Mini. I will actually do a YouTube video on how to access AMP Mini and do a report that I want you to do, but I'll kind of give you an idea of what it is today. You have your workbook, and that's 10%, so that's, like I said, with your positioning class, so that's just pretty easy to get full points for. Just do your workbook and you get it. So you are also going to present a pathology under the discussion board, and I'll show you where all that's at. Your quizzes are going to be 20%. Your test 1, test 2 are going to be 15% each, totaling 30%. Your final exam is 20%. And you know me with my cumulative final exams, so you're always going to get a cumulative exam with all my classes. And you have to pass the final in order to pass the class, so make sure that you do well in the final. It's the same situation where you're going to have 2 minutes a question. So for each question you have 2 minutes. So you'll have to know where the information is or know it in your head in order to do really well on the exam. If you have DSPS, make sure we get those requirements up ahead. I expect you to be online. I expect you to do this class on your own. So no makeup work, and you have to participate in the discussion boards as they are posted. Be nice to each other and don't discriminate. Read the code of conduct, and that's it. So let's take a look at your schedule. My computer's running really slow, so I apologize. So your schedule here, fall, there's your CRN number. We're going to start off with just an introduction to what pathology is, and we're going to go into the GI system. We're going to talk about the esophagus, stomach, and small bowel pathologies. Then we're going to go into the colon, gallbladder, liver, pancreas, and spleen. And I've aligned this class with your positioning class, your 210 class, so that you can learn the pathologies that go along with the anatomy. So kind of cool. Here's your urinary system on the 18th, and then you have exam 1. So same idea, 2 minutes a question. You have to know your stuff in order to do well, so make sure you read and really prepare for the exam. Then we go into reproductive, respiratory, skeletal. So now respiratory, skeletal, we should be pretty much on track. Exam 2, cardiovascular, nervous, hemopoietic. For the next set, you have a holiday there for Thanksgiving break. Endocrine and traumatic imaging, easy for me to say. Then we have miscellaneous disease and pathology presentation, which will be the week of December 4th. And you have your cumulative final exam on the 11th of December. All right. So if we go into your learning modules, you can see each week I've got all of your stuff loaded. And we have Intro to Pathology, and you've got your PowerPoint recorded, and your PowerPoint here with your quiz. So you have 60 minutes to do 30 questions, so 2 minutes a question. It won't release until the 21st at 12:30 a.m., so don't look for it till after that point. I'm going to pace you guys whether you want me to or not. You can't do it all in one weekend. Sorry. So as you see, we go through each system, so you can follow along with your positioning class. In the assignments, we have Aunt Minnie. So what Aunt Minnie is, it's the website. So if you go to auntminnie.com, you'll see case of the day. So, and I'll do a whole video on how to do cases of the day. And for the first week, you're just going to do any case, whatever case you find that you find interesting. Now, I don't expect you to get any of them right. Now, these are strange, weird cases that people send in that are not normal. So, they're going to show you what imaging, the different CT, MRI, and ultrasound, nuclear medicine, and they're going to say, what do you think it is? And you're going to guess. Now, I expect you to get them all wrong. The idea is at the end, it tells you what the pathology is and all the signs and symptoms and treatments and everything else. So you're going to post every week different Aunt Minnies as we go through, so you can see all of them are loaded here. You're going to want to make sure that you do them. Now at the very bottom here you have your pathology imaging assignment. So you are to present a pathology you find in the clinical setting. So something that you've seen that you thought was really interesting. You're going to find out the patient history, so usually from Epic. You can find that, or some online service that you guys, whatever you guys use for your medical records. You're going to look up the patient's symptoms, images of pathology. So if you're an x-ray, I want you to show me some x-rays. If they had a CT or MRI, nuc med, ultrasound, whatever, if you can get those images, that would be awesome. Make sure you take all patient information off those images. And then the continuum of care. So what imaging did they have done? Also, did they have surgery, chemo, radiation? What did they have done for treatment of this disease? And then I want to know the pathological process of the disease. So I don't want you to go to Wikipedia. I would like you to go to WebMD or some legitimate site and find out what the normal pathological process is. If it's a 5-year survival rate, whatever it is. So that goes along with your lifespan. How long do patients typically live with this pathology? Can they live their whole life with it, or is it just something that they will pass within a few years? I want to know what treatments are typical for the pathology and the survival rate. Anything else you find interesting about the pathology, I want you to list also. So use the internet, use your books. You have a lot of books on different pathologies. Make sure you reference your material. So it should be about 2 pages in length, and you're going to post that up for me. So workbooks due in RADT 30, so you're going to turn those in also. And like I said here, 50% grade reduction if it's not complete. So make sure you get it all done. Okay, so this is all of your assignments here. Okay, so I'll do a separate video on how to do an Aunt Minnie case. Really easy, really cool. I love Aunt Minnie. I jump on it every once in a while, just keep my brain fresh on pathologies. So, all right, that's it. Enjoy the class. If you need anything, feel free to reach out.